We are at the forefront of many innovative and exciting things developing in the world of senior living. With Tim Mallad, CEO of Forefront Living, as our guide, this show will shine a light on how older adults can embrace these changes to live active, happy, fulfilling, and thriving lives. Through discussions with senior living and hospice professionals, architects and designers, and people of all ages, will help today's seniors envision the art of the possible and take steps toward achieving the future of their dreams. Welcome to At the Forefront.
Welcome to At the Forefront. I'm Tim Mallad, CEO of Forefront Living. In today's episode, we're going to talk about therapy services. And when you think of senior living, you automatically think of physical therapy, but we'll touch on speech therapy, occupational therapy, and all of those elements together. Today, I'm very, very happy. We have two people that I know very well. The first is the Reverend Dr. Cynthia Logan, and Cynthia is also a Presbyterian Village North resident for the past 8 years. And then Estee Cahani, Doctor of Physical Therapy and Rehabilitation Director at Presbyterian Village North. So welcome to both of you. Welcome to At the Forefront. And you both are definitely at the forefront when it comes to so many things. And perhaps to begin, maybe we could talk a little bit about your backgrounds. Dr. Logan, would you like to tell us a little bit about you and who you are? And then we'll ask Estee to do the same.
Well, okay. I'm a Presbyterian minister. I've served 3 congregations in Dallas, and I also served an interim chaplaincy at PVN many, many, many years ago when Joyce Hall was brand new. So my experiences with congregations, especially in pastoral care. I earned my doctorate from SMU, and I'm now a widow, have 2 extraordinary stepsons, and they're both married, and we have 8 grandchildren. So I'm busy with all of them, and it's thanks to physical therapy that I'm able to participate in their lives.
Wonderful introduction. Estee, tell us a little bit about you.
Yes, so I am a doctor of physical therapy. I've been with Forefront this year, will make 10 years. First with our old sister community, Grace Presbyterian Village, and then I've been at PVN for 6 years. And I'm from New Orleans. I have 2 young, boisterous boys that keep me young, and I've also dealt myself with quite a bit of back problems and been to therapy myself. So when I say I understand what you're going through, I truly mean it.
Yeah, that actually it helps a great deal because I would be remiss to say that not only am I the CEO, but I've been a patient. So and have experienced the services we're going to talk about. So Estee, what attracted you to the field and where you are now?
Yeah, so I've always been very into exercise and wellness and nutrition, and my father was a professor of orthopedics and biomechanical engineering. So when he saw where my interests were, he's very much into academia. He thought physical therapy would be the right track, and I started and just never looked back. It's just, fulfilled my purpose in every way.
Can you talk to us a little bit, a lot of individuals, and if we're talking to seniors today, and seniors are watching this, you really think of physical therapy as I've had an acute situation, and I've been hospitalized, and I have X number of days, and I go and I exercise at a nursing home, and I come back, and most of the time that is physical therapy, but there are other therapies, and there are other journeys. Can you give us a little bit of a description of how it works, even to receive the services?
Yeah, absolutely. So we have a pretty large team of 24 on our therapy team, And, the magic to it is a collaboration. So we have physical therapy. They work mostly in mobility, pain management, joint integrity. But then you have occupational therapy. So you think of activities of daily living. Can I get myself dressed, use the bathroom, take a shower? A lot of what we do overlaps. So it can be a little bit confusing sometimes. If you get a shoulder replacement, you might get occupational therapy, you might get physical therapy, or both. And then we have speech therapy. And the name is so misleading, and a lot of people don't quite understand what they do until we go into the whole pitch. But most of what they work on is not strictly speech. They're like, oh, I can speak just fine. I don't need speech therapy. But what they're working on mostly is cognition, memory loss, word finding, managing your day-to-day life, and then also swallowing dysfunctions. And they do, work on speech also.
We think of this, very much happening in an institutional setting, so that you're residing in skilled nursing, but that's not necessarily so, especially if you live in a continuing care retirement community. You have the ability to go into other levels of care. And can you tell us how that works?
Yeah, so we provide therapy services in all levels of care. So independent, assisted living, long-term care, short-term rehab, and we also see people that don't live at PVN from the community. So while many of our patients are in a very short-term rehab after a hospitalization, the majority of our caseload is actually residents and independent and assisted living who might not have an acute episode at all. It could be very chronic. And I think that's where we really try to break down the stigma of, even if you've had this pain for many, many years, it's something that we can work on and help you with. I think that's what gets me, is when they're like, you can't help me. And I'm like, just give us a chance, and I think we can change your mind.
When we were talking about this topic, and we were thinking about how, we could form a panel perhaps, and have somebody from independent living, assisted living, and skilled nursing talk about their individual experiences. And our producer was like, you wouldn't be able to fit that many people at the table, and, talking to that many people, it would exceed the time. And then a name came to mind, Cynthia Logan, and a journey that you had been on, Dr. Logan. When I met you 8 years ago, you were living in independent living, but then you had a journey that took you out of independent living for quite some time, and you're back in independent living. Again, different residence, but you're back as an independent living resident. Can you tell us a little bit about that journey? Because I think it's a journey that really, if we talk about art of the possible in our introduction, it really is.
Yes.
Yeah.
Well, it was a complex journey, but the essence of it is that I had severe back problems. And so the back problems produced sciatica in my left leg, such that I could not move or stand or walk without being in awful pain. And so in the process of that, I also was on a lot of medication. And in the process of dealing with all of that, my husband passed away. And so the grief then complicated the pain as well. So about 6 months after my husband passed away, I had back surgery. And
major back surgery.
Major 7.5 hours of back surgery with fusions and so on. And it took a long time to get off the pain medication and to begin the rehab journey. But eventually I've been to all three of the places that you mentioned for
Yes.
care. I went to TRC and received care there, and then eventually moved to Joyce Hall and stayed there for about 15 months. And all of that time, I was receiving physical therapy. Much of that time, I also received occupational and speech therapy.
We talk about the journey, and so if you're part of a retirement community or you're in a continuing care community, often will determine success is that you've left the skilled part and you've moved to assisted living, which is a success level for us so often. But you took the journey and went one further, and you came back to independent living after 15 months in assisted living. Tell us about the services and how they were provided and the relationship with the person, the therapist, because you mentioned something earlier when we were talking about that they stuck with you, and I thought that was just a different perspective. So,
well, it was hard for me I couldn't even walk when the surgery was completed and everything, and so really couldn't do anything for myself. And my physical therapist, who was assigned to me, would come and visit with me and work with me. And sometimes I would say to her, "Oh, I don't want to do anything today. I hurt too bad." And she was sympathetic, but she would say, "Well, just try once." And so I would. And then she'd say, "Do it one more time." And she just kept encouraging me, and she'd say, "It'll get better, it'll get better." And this lady, Estee, was always there checking on me. "How are you doing? What do you need?" So on, as she was with all the people that were there in therapy. So those two people really helped me. And it's interesting, but even the therapists that were not my therapists were supportive and encouraging, as they were with all of us that were in physical therapy. And when one of us was able to do something, all the therapists would celebrate.
Yeah, absolutely. You mentioned that you also had a hip replacement.
Yes.
And you mentioned that, the pain continued until you had the hip replacement and then that recovery. How did that come about?
Well, I just could not walk. My leg just would not support me. And finally, my doctor said, part of the reason is that you favored this leg so much that you wore out the other hip. So, and I think that happens every now and then, but anyway, so then the hip was replaced, and that evened me out, and I was able to get out of the wheelchair and stand and begin to walk, and eventually move forward, literally.
Literally, and I'm going to interview myself now, but as having been a patient as well, and I had a fall, a Yellowstone, which then just led to a really interesting journey, and I was very much not to the level you were, but I was having terrific pain, and as we worked through things, my therapist was addressing what I assumed was a knee issue. But over time, she gathered that there was something chronic that had been going on with the ankle that she suggested I go back to the doctor. She pointed out, I am not a physician, but I suggest you go back to the doctor. And we addressed what that was, which turned out to be the key issue. Things started happening. And Estee, you said earlier prior to the show when we were talking that that's not unusual, that things are interrelated, and sometimes they're going on for a longer time. How do we become aware of that? Dr. Logan was favoring a leg for so long, and unbeknownst to her, it caused a hip issue. How common is that?
It's extremely common, especially with seniors. I mean, we have aging bodies with aging joints. And I think a lot of times when you're having such severe pain in one area, that's all you can concentrate on. And once that's kind of relieved a little bit, then you start feeling the other joints. But you mentioned, when you're doing therapy, we look at the person as a whole, right? You might have come for back surgery, but with the reporting of how you're feeling and just really having that open conversation with the therapist, it helps them to try to identify if there's something else going on. Because if you didn't go back to get your hip looked at, your journey would have been much different and much more frustrating. Same, for you. I think it's listening to your body. I lecture people on that all the time because we all tend to, not do a good job of, pushing away aches and pains, and your body will tell you when something's wrong.
But talk about that, because we do push away the aches and pains, and, whether you have, especially with the back, and something goes wrong with the back, and then it gets better, and then you move forward. When is the right time to have something looked at, or how do you avoid an acute episode? And really, because you don't have to have an acute episode, if I'm correct, to have these services.
No, we really try to educate our residents on being proactive. Don't wait for something to go wrong. Don't wait to have a fall. Don't wait to be in such severe pain where you're stuck in bed. If you start noticing a difference or something, go see your doctor. Most doctors are pretty pro-therapy. It's a conservative measure to try to avoid surgery. You'll get much better results if you try to, address it early on than waiting until it's a severe problem. And it's really just making the time for your health. We're all busy. We all say, I don't have time to go to we all have time. You make time for what's important, and your health is important.
Well, exactly. And I think, and I was thinking as you were speaking, the one thing I think you've done a very nice job of in our organization is you've incorporated our rehab services throughout the continuum, and very much a presence along with our wellness department, a partnership, I would say, in independent living. And I think we had assessments, and I heard a lot of the residents were excited just for an assessment. Can you talk about that process? I'm an independent living, I'm an independent senior, and why would I go for a rehab assessment?
So we do one of the wellness kind of proactive things we do quarterly are screens. So people sign up, they come for a 15, 20-minute session. We check your balance, we check your strength, just a general screen to see if, something's changed since the last time, or if there's anything, that's a little bit alarming that a doctor should probably address. And that's a good way to keep a pulse on how you're feeling, because sometimes it's hard for people to notice, my legs have really gotten a lot weaker, or sometimes they need someone to tell them, you need to go, seek medical assistance for that. So once they do that, if there is a reason to start therapy, they would go see their doctor and get a prescription for therapy, and we would start and do a formal evaluation where we can really make a plan of care that's customized to you to work on what you're needing.
And it doesn't necessarily, we're talking a lot about physical therapy today, but, Dr. Logan, you mentioned the speech therapy and the other therapies, and we don't always have a good understanding of those, but I would take it the screening would also look in those areas as well.
Yes, we do them for all disciplines. So the speech therapists have a cognitive screening that they do. They've even done ones for swallowing issues. But what's funny is a lot of times they'll come to do the occupational therapy screen, and they'll miss their appointment several times and be like, do you have a hard time managing appointments or remembering? And they'll be like, well, yeah. I'm like, well, how about, we look into that, because, that can be very frustrating for someone when they're consistently having a hard time just managing their day. Where do I need to be, and keeping track of their day.
Or the word finding. You mentioned word finding, and that I didn't realize, as long as I've been in this business, that that can be addressed and you can make progress with that.
Absolutely. And it's frustrating. It gets so bad sometimes they avoid socializing. They won't go to the restaurant for dinner. They won't go out with their friends because they feel like they can't say what they want to say. And, that's awful. When you come to PVN, we say, now it's time to live your best life. Use the resources we have to get help. And I hate that a lot of people think you can't help me.
Well, there is that point, and I think it's a good segue into the next question, is there's that dreaded word, the plateau. Maybe we've stalled. You're smiling. I know you've heard that word. You've got the plateau, but as the patient, there's the frustration. I think there's the despair, a little bit of anger when you're like, how did I end up like this? And, why am I not making the progress? Talk about maybe that journey firsthand, having gone through it. When I vividly remember talking to you when you were in a wheelchair, and and today you walked in and walked up together, but there were times in between where you were in the wheelchair. Can you talk about those plateaus and maybe the times and the frustration and how you got through some of that?
Well, there were times when I just felt stuck, and I didn't think I could improve. And that's when it's nice to have professionals who can tell you, yes, you can improve, and we're going to help you do that. And in TRC, which is when I was always in a wheelchair, the therapist I had over there was one who would say, you're not going to stay in this wheelchair. We're going to get you out. We're going to do it. You're going to do it. And I know you can. And the way they move you off the plateau by giving you the confidence that you can move up to the next level. And,
it's a partnership, and I
yes.
think they pick up the load per se. There is invested as we as the patient. I'm saying we have on the other side as we are. Estee, talk about that. Talk about that partnership with the resident or the patient and how that works.
I'm smiling because we always, it's a joke in therapy, especially, physical occupational therapy. We don't address, we're not, psychologists, but we also call ourselves mental therapists, because that's a large part of it is the relationship and getting into someone's head and seeing what are the barriers, how does this person get motivated. And I think one of the main things to do is just, finding a way to let the person you're working with know you truly care about them. I am invested in your success here. And if you're willing to work for it, I'm willing to work for it. And sometimes that's what they need, is that person when they're not feeling strong enough that day to get up out of bed and do it, they're in pain, is to have that smiling face come in of the person they know cares about them. And they're like, okay, I can do it. And, as a therapist, that can be a heavy load to bear sometimes, but, the residents give us that in return. It's probably one of the most rewarding jobs because you get to see their success and, the relationships. I did an interview with one of our other residents for the Bugle the other day, and what I told them was that once you've done therapy with us, you have an advocate for life. It's not just, when you're done with therapy, that's it. We don't talk anymore. Like, I know every time I see you, we embrace and, you have this bond, it doesn't just go away. And that's the special part, think of what we have at PVN.
Well, I think what is also so interesting, and you talked about it earlier, was, we have we have beautiful gyms and we have wonderful equipment, and we have, of course, I'm being a little partial now, we have the best therapists, but the other patients or the other residents that are there, it's an interesting experience when you're in a room with other people experiencing therapy, and the other therapists are also, while the therapy is individual, it's very collegial. Is that the right word, perhaps? Can you talk about that experience and being in the gym with others?
Yes, well, it was collegial. There was a part of it that I have to say about the relationship. Even when I didn't feel like doing something, I knew you cared, I knew my therapist cared, and I didn't want to disappoint you. And so I would try And there's that aspect with the personal relationship with the people in therapy. But the collegial issue of it is it's all for one and one for all.
It is.
Essentially is what it is. Everybody wants to see everyone improve.
Absolutely.
And that's a beautiful thing. And I don't know if that happens everywhere or not, but it sure happens at PVN.
Well, it happens on the outpatient side. I had therapy at the same time with another individual, and he was a senior. Mm-hmm. And what I thought was fascinating, there was an exercise I could not do, and I was struggling with it. And Anna would, every time it was do more. When I finally met what I did, he congratulated me, because I guess I was pretty vocal about, I can't do it. And then he's like, you can do it. You did it. Right. And that meant so much to me. Exactly. That, and then he was frustrated with his progress. And I'm like, you are so far from where I am. You've been on the bike for this long, and I haven't even made it to the bike yet. So it is that we're invested together. It's a very, very special relationship. Mm-hmm. Very thrilled that you're with us in independent living again. I too.
Thank you. Me too.
I think that at the core of who we are, and at the core of this organization, we have wellness and well-being. And I would be remiss not to ask you about the spiritual journey, because we're a faith-based organization. Mm-hmm. And you associated with us. You touched us through the chaplaincy, and you've been with us as a resident. Can you talk to us about that element of our organization and how that helped the journey?
Well, part of it is the chaplains did come visit me and check on me, and that meant a great deal. And they would pray with me, and that was very helpful to me. They seemed to understand that it was a spiritual struggle as well as a physical one, that I was wrestling with the grief of losing my husband, and all the many changes that were happening in my life, things that I didn't want to happen at all, and having a hard time seeing how I would go forward and identify, how I would structure my life. And then not being able to walk complicated that. So
just a bit.
Just a bit. So it was pretty discouraging. But the staff and my family, my friends, all kept encouraging me. And I think I would have given up, except none of them would. So I had to keep going.
How wonderful. And I would like to thank both of you for being here. Estee, I would like to thank you for the wonderful work you do and the wonderful work of the team. And I have to agree with you. Estee's always in the background when you're receiving care and you get an email. Especially I did it probably when I wasn't doing what I was supposed to be doing. Like, don't tell Estee, but always just checking in, seeing how you are. That means a great deal. Dr. Logan, I think you've inspired all of us at PVN, and I hope everyone here walks away from this situation knowing that don't give up. It's always possible. So with that, I thank you for joining us at the forefront and look forward to when we're back together again. Thank you.